So, while I was pregnant, of course, I went to the doctor for my weekly doctor's visits. And as you get closer to your due date, it's going to not only be every other week, but maybe every week, or even maybe sometimes 2 times a week, especially with me because I had the non-stress test. So, when going to the doctor, guess what? It's only you that's going to be allowed to go into the doctor's office, okay? If you have your husband or your partner or any other family member coming with you, they can only sit in the waiting room. They cannot go with you back into the doctor's office to listen to the heartbeats and looking at the ultrasound or just being there for support. So the way that they can support you, your family, is just by sitting either out in the parking lot waiting for you or sitting in the waiting room. Let's talk about COVID because that's what it all boils down to. That's why they're doing this. So once you get to the doctor's office, they're going to take your temperature. I think I hear some mucus. We'll fix that. They're going to take your temperature. They're going to ask you the screening questions, and then they'll check you right in. But make sure you are wearing your mask, all right? At all times, you do not take it off for nothing. Yeah, so when I first heard baby V's heartbeat, Damien was not with me. He wasn't allowed in the room. But every hospital is different because the first time that I heard her heartbeat, they told me that he wasn't allowed to come in, but then they said for future ultrasounds that he could come in. All right, but I just know for any other doctor appointments that I had, he was not allowed to come with me. Yeah, so when you are about to give birth as well, a week before your scheduled procedure, they're going to have you take a COVID test. Okay, so we've all seen the videos where they take the Q-tip and they stick it back and it's pretty much like, oh my God, they're touching my brain. They did not do that to me. They just like went around like the outer portions, well, they still went inside, but it was like probably up to here that they did. They just swabbed it around both nostrils, and that was it. I got my results back within 24 hours, and it was a negative. Yay! Thank God. I have heard of women not being able to hold their babies right after giving birth if they tested positive. But then I guess every hospital, every state is different. So make sure that you are asking your doctors and your nurses those questions. All right. As far as having any visitors in the hospital, I wasn't allowed to have visitors come visit me in the hospital or baby V. The only person I had with me was Damien. You can only have one person with you. And upon entering, they did screen us again. And then we went on up. He was able to leave out and come back, you know, if he wanted to pick something up to eat or if he needed to come home and check on anything. And once he did come back to the hospital, guess what? They did have to take his temperature again, just for safety measures. Still wear your mask in the hospital. Yeah, so I could only have Damien with me in the hospital, and then at the doctor's appointments, I couldn't have anyone at all. If Damien did come with me, he was either sitting out in the parking lots or he had gone to my mother's home to visit her since she's close by. But that was my experience during this pandemic. Yeah. If you do test positive for COVID right before you go in and give birth, then they will give you a phone call to tell you, hey, this is what you need to do, the next coming steps. These are the steps that you need to take, like right before coming into the hospital or at the hospital. I'm not sure. But I know with me, because I tested negative, they told me as soon as you leave from getting tested, you have to go home. You can't come in contact with anyone. You can't go anywhere. You're pretty much on lockdown. Just because, hey, you go out to eat or you go anywhere, come in contact with anyone, and boom, like that, everything can change. Yeah, so it was very, my husband and I were very strict with family and friends when it came to me, as far as being pregnant, because I know that they said not only the elderly and small children were high risk, but also pregnant mothers were high risk as well. So we had to take some extra precautionary factors. Yeah. So if you have any other questions, inbox me. I'll be sure to answer them if I can. If you want to have a conversation, comment below. All right. Bye.